right? Nice eyes open. Okay, got it. All right, we good? All right. I guess I have a habit of when I speak in public, I blink a lot, and Kevin can't get me to keep my eyes open for more than 5 seconds. So we had this discussion prior to the meeting. I think I accomplished my part of the goal. Dr. Mooney, who will be speaking with us today, had no idea that I had friends in marketing at the Penn State Hershey Medical Center. So by the time I'm done reading her bio, I think I'm going to cut into most of your time. So they were very pleased to tell me all about Dr. Mooney. But Dr. Mooney is here today with us, Senior Vice President and Chief Operating Officer at Penn State Health Lancaster Medical Center. As the Senior Vice President and COO for Penn State Health Lancaster Medical, Claire Mooney has responsibility for the hospital's day-to-day operations. Prior to joining Penn State Health, Dr. Mooney was the president and CEO of 2 Tower Health hospitals. I had to read that twice when I was reading. I was like, 2 Tower Health, got it. Brandywine Hospital in Coatesville, PA, and Jennersville Hospital in West Grove, PA. Under her strategic direction, the hospital improved operating revenue growth, increased hospital admissions, decreased readmission rates, and reduced employee turnover. Her earlier career included leadership roles in nursing administration for Tower Health and Penn Medicine Lancaster General Health. In addition to serving the Chester County Workforce Development Board, Dr. Mooney is the chair of the Chester County Economic Development Council for Healthcare Connect and is a member of its board of directors. She is the recipient of the 2022 March of Dimes Salute to Chester County Women of Achievement Healthcare Award, and in 2021 she was named the Chester County Council's Vista Leadership Megastar. That sounds awesome. Thanks. Mooney holds a doctorate degree in nursing practice and a master's degree in leadership and health systems management from Loyola University in New Orleans. In addition, she earned a master's in business administration and healthcare from Alvernia University in Reading and a bachelor's degree in nursing from Immaculata University in Immaculata, Pennsylvania. She received a certificate in healthcare finance from the Healthcare Financial Management Associate. Please join me in welcoming Dr. Claire Mooney.
Thank you, Sean, and thank you to the Rotary for having us today, and also thank you for sitting us with David. He has been probably the best lunch date I've had in months.
Please don't encourage him.
On the opening day, I want you just to come and bring your good vibes. So at Penn State Health, we are so excited that in 9 short days, on October 3rd, we will be opening our doors to the East Hempfield, Lancaster County community. As you can imagine, lots have been going on here in Lancaster County, getting ready for the opening. We will have about 1,000 employees starting to work with us on day 1. And this week, I believe Monday, we will have our highest orientation group, which will be close to 170 people who will be starting. We actually have to hold orientation at Spooky Nook. We don't even have the space. In addition to that, I'd really like to just talk a little bit about the hospital, about what we're planning and what we're doing, and how we're here to serve the community. So one of the big things is we're going to be opening with 142 beds. These beds are specialty beds along with med-surg beds, so we have a fully functioning emergency department which will have 37 beds. But in addition to that, there's a lot of discussion about overcrowdedness in the ER, how to become more efficient. And one of the things that we're going to be doing is, if many of you have ever been to like a Texas Roadhouse or a call ahead seating, we have an app called In Quicker. So in terms of technology, and I don't know if any of you have ever hurt your back, but being a nurse, my friend Jen's a nurse, we have hurt our back before, and it's very difficult to sit in a waiting room when you're in so much pain. This app will allow you to say, you know what, I think I can be up and ready by 10:30. Oh, they have a time slot at 10:30. You pick your time, you come. And one of the unique things we're doing is many times you go to the ER and you're met by a non-clinician who registers you. Not in our ER. You're met actually by a clinical nurse who will triage you and get you where you need to be quicker. Our opportunities in terms of serving the behavioral health community, we have a state-of-the-art behavioral health area, which actually is one of the only risk-free behavioral health options in the state. One of the things, once the patient's medically cleared, there's actually a garage door that comes down so that prevents themselves from hurting themselves. We also, and we hope we never have to use it, but we have what is called safety technology. It's for sexual assault victims. It's a private consultation room along with peer-guided exams, SAFE, which is the sexual assault nurse examiner, that are often very litigious. So we actually have a peer review, which is part of the telehealth option that allows us to really keep the patient safe and keep the evidence safe for collection. We're very excited about our state-of-the-art operating rooms. We have 7 operating rooms and a hybrid. So our hybrid OR lets us do state-of-the-art endoscopy in little tiny needles that our interventional radiologists and our interventional cardiologists do to help keep our hearts working and our veins working. So that's one of the things that we open with day one. We will also have a family birthing suite, and Carol Newsome, who is our Director of Family Nursing, before she came to work with us, she opened the Emirates Hospital in Dubai. So her experience, 35 years, is really one of those exciting pieces that we're happy to bring to Lancaster County. In addition to that, we have 500 pieces of curated art from Lancaster County residents. So this weekend we are holding a community open house from 4 to 7. You're all invited. Come, we'll take you on a tour and you can see just how beautiful the artwork is by the residents of Lancaster County. I'm blown away. Every day I see a new piece or I see something, or our friend Sandy, who works at the Water Street Mission, her husband has 2 pieces in our hospital. They're stunning. And so I think, art's such an important part of healing. But I think the most important part is the people. So our team that's been coming together, who've been training and doing drills, and just yesterday we did a mass casualty event where we interjected different patients, different scenarios, and a simulated bomb explosion. And it just was so great to see the collaboration of the township and the county, along with our SWAT teams that we've been touring, our fire chiefs, and our EMS providers. So I'd certainly take any questions you have, things maybe that I didn't go over, things I can answer, maybe potential career in healthcare. We always could use more nurses. Oh, you want to be a nurse?
Yeah. I'm actually taking classes at the EMS Northwest Station.
Awesome. That's fabulous. So that's great. Glenn with 1 N.
Thank you. So, recently, the hospital out on Worksville Road on 81, that opened. You guys are opening. It had to be a challenge to find people.
Well, that's a great question. So I am really proud of this fact. I'm actually opening my hospital with 0 agency nurses and 0 new graduates. And you know how I did it? Because it's a hospital ran by nurses. So myself, my chief nursing officer, my chief quality officer, and our directors, we were able to really network and bring a lot of nurses into the state. And I think one of the other things that's very unique and different, about a year and a half ago, I was explaining to David that we lobbied to make sure that Pennsylvania is now a compact state. So it used to be very hard to get licensed here in Pennsylvania as a nurse, but states like Delaware, Maryland, DC all have a compact licensure. You pay for 1 license and you're licensed in all those states. Not here in Pennsylvania, but we are now a compact state, so we're able to attract different people. So we do have a large influx of people, along with finding people who want a different idea, a different culture. Yes, sir.
So when you say the hospital run by nurses, so how will that be different? Talk more about that.
So in our when I say run by nurses, so lots of times when you have people who are in senior leadership, they may be accountants, and nothing against accountants, but they may be, the CEO or the COO are accountants, or they're business folks. And so in this hospital, all of the senior leaders, so the vice president of medical affairs is a urologist, he's a clinical individual. The chief nursing officer has been a nurse for 35 years. Dr. Sonnen, who's running quality, is a nurse practitioner. And then myself, I have a doctorate in nursing and a doctorate in leadership. So we're all clinical in nature, which is a lot different than some of the other hospitals.
From a patient perspective, how will that be different?
Oh, so from a patient perspective, one of the things that we're implementing, it's called relationship-based care. So it's the focus on the patient and the family, But in order to do that, you really have to also focus on self-care and care of your colleague. So we implemented a model where it's really about, are we taking really good care of ourselves? Are we taking really good care of our colleagues? Are we taking really good care of our patients and their families? Oh,
Go ahead, Bart.
okay.
What was your impetus to put a hospital in Lancaster County? I mean, we're so close to Hershey, it's like,
So one of the impetus is really the strategic vision of Penn State Health. So they have in mind the 0, 10, 20, 30 rule. So 0, which means telehealth at your fingertips, 10 minutes from any location, primary care, 20 minutes destination to our specialists, and then 30 minutes to acute care. So that was the visioning behind that.
okay, cool.
Yeah.
So up at Penn State in Hershey, it's a teaching hospital, you have Children's Miracle Network, you have,
Right, community.
pediatric heart transplant, blah, 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 blah. So what's different?
So this hospital will have not pediatrics, so we will really be in close communication with the Children's Hospital of Hershey. We will see pediatrics in our emergency department, but we will not have an inpatient pediatric unit due to the specialties that there are at Hershey. We do have alignment with the Lancaster Pediatric Center that opened on Harrisburg Pike by the Wegmans, and we will not do transplant. We will eventually have residents in teaching. It will be a teaching hospital. So when I say new grads, I think new graduates to open a hospital is probably not a great idea, but once we're established, we will welcome nursing students, students in laboratory, radiology, and of course our residents.
I do want to make a comment.
Sure.
The Penn State, the pediatric unit there on Harrisburg Pike in the old Toys R Us
Uh-huh.
is phenomenal.
It's beautiful.
I tell you, yeah, it is. You know, and you walked right in, and they were so efficient and so kind. Like, we didn't sit down in the waiting room at all. It was
Right.
just straight through, and it's so cool with the Nittany Lion outside on the bench.
The layout and the design, yes, I actually was a secret shopper. I took my own high school senior there for her 12-year exam, and let me tell you, I didn't tell her about the needles that she had to get, so it was probably a good thing we didn't sit down. We went right back in. So yes, it is very efficient. Anything else? Any other question?
So you mentioned about the whole ambulance.
EMS, yes,
So EMS is in crisis in our whole area, we all know that.
absolutely.
I have heard over and over again, if you have a problem and you have to go to it's better to go to the emergency room in an ambulance, because you're right in, you don't have to wait. So if you advertise your plan more,
Right.
you might cut down on that.
I agree with you, and I've been advertising to EMS, but I will tell you, I hear from a lot of EMS providers that they actually do go to ERs and they wait
Yeah.
for a bed or a bed assignment, and they're, and that's preventing them to being really where we need them, which is on the road. But I think we need to do a lot more in terms of helping support EMS and supporting scholarships for EMS, because we certainly need them. Yes, sir.
You mentioned the open house, the days and the hours?
Sure, so this Saturday from 4 to 7 p.m.
Saturday.
Yep, absolutely. Yes, sir.
A number of months ago, we had a wonderful program on strokes. And there are different kinds of strokes,
Mm-hmm,
and what you have matters,
right,
and it needs to be addressed or not addressed in one particular way or another.
correct.
And there are medical facilities that are certified to do whatever, and I forget the terminology.
Yep,
Go to this hospital, not that.
right, stroke accredited, so yes,
Okay.
we will be,
Okay.
yes.
That was my question.
Right, we just passed our accreditation for cardiac excellence. We had that survey this week. And if you want any information on any things, whether it's heart attacks, strokes, Dr. Michael Rehart, who's a big ER provider, he worked for Lancaster General Health for 25 years. He is actually the head of our ER. So he would be happy to come meet with your club and talk about minutes matter.
A colleague of mine worked for the United Nations, and their healthcare system was just a reimbursement. So whenever he would need something, he would just pay for it, get
Sure.
reimbursed.
Mm-hmm.
He said that when he would go to the hospital and get something done, and it would tell him that, they would charge him less than half of what the going rate would be. Could you just talk about the whole healthcare system in the United States and what you think of it and stuff like that?
Sure. So I'm actually married to a European myself. So my mother-in-law, they're from Belgium, and yes, so it's very, very different. But I will tell you, my grandmother-in-law did have her heart surgery here in the United States because she had dual citizenship, and she was able to get it done a lot quicker than if she was in Belgium. But I do think that there is definite need for healthcare reform, healthcare insurance reform, and we really have to figure out how we can insure more people so that the bills are not astronomical and that the coverage is what it needs to be. I do think on the consumer side, it becomes very difficult when people go to their doctor and say, I need an MRI, I want a CAT scan, and not realizing that medical advice may not warrant a CAT scan. You may need an x-ray. So I think there's sort of that education on one side and also the knowledge of saying, how do we really look at how this is reimbursed, and how are we going to be able to make sure that for our senior population we can still afford to cover through Medicare and of course Medicaid, the Medicaid programs.
So Bart, to play off of Bart's question about why building here.
Sure.
So we all know about Tower Health and Jefferson.
Yeah, sure,
So
yeah.
we all know
Yeah,
about
right.
closing.
Right.
So it leads me to the question of, so there are so many small little facilities
Right.
in our community, many. Could take you to any town, Paradise, kids are in their
Right,
course,
sure.
wherever, and they have these little places. Are we ultimately going to see some sense of consolidation to where we become a more efficient act? And
Mhm.
are we, from a expense, can we afford to have all of them and all of you guys
Right.
too? Is there a way to make that better? Can we synergize?
Sure. So I think there's always opportunities to synergize, and I think the whole, in my opinion, the belief about the systemness. So if you have a system and a standard, I mean, for us, we are very fortunate that we have a medical center that produces top quality physicians. We also have healthcare here in central Pennsylvania that, and in the state of Pennsylvania, that you wouldn't see elsewhere in the country. So from that standpoint, I feel that yes, the consolidation probably will happen and may get accelerated, but there still should be options. And I think that's really the important piece. But I also feel that not every hospital should try to do everything. And that's really where the price and the cost. And so, I could have built a 300-bed hospital, but we chose to build a 142-bed hospital with room to grow so that we could contain the cost and that we would be able to deliver a more cheaper option to Lancaster. Yes.
Do you ever see a time when, you go to the hospital, you go to the doctor, whatever, and they say, well, you're gonna need this test, this test, this test. And you have no idea how much this costs until you get what the insurance didn't pay.
Price
So-
transparency.
Right, so it's like a menu option. Your x-ray
Right.
costs this, cause you mentioned about the MRI, somebody going in and saying, I want an MRI. Well, if you hurt your knee, the insurance always says, oh, you gotta go get the you gotta go do the physical therapy first, then you gotta get the x-ray, and that doesn't work, then you do this. And in the end, you needed that MRI to begin with. So, but, like a menu, and this
Right.
costs this.
Right. I can absolutely see us doing that, and I can absolutely see more care moving to the home, more care being delivered through a telehealth option. I don't know what the thought is on terms of personalizing that. I think there's certainly, in my opinion, opportunities to make that more personal, but yes, in terms of cost transparency, we're absolutely moving towards that. And I think from a consumer standpoint, should be at your fingertips.
Just an example of how crazy it can be. Our insurance company said there's online, you go online and see the cost of a
Cost.
certain things, like for a knee replacement. So, and they wanted us to be good consumers and all that. So I went online and looked for a knee replacement. It was from $10,000 to $125,000. which hospital I would go to.
Mhm.
It just didn't make sense to me, so, you know, am I getting something better for 120? I mean, it just is crazy, so I don't know.
No, not necessarily. So the cost for I'll just use your example, the knee replacement. So depending on your surgeon and the type of implant they use and the company they're affiliated with, you could have a knee, because I have a parent who's had a knee replacement, and, you know, she went to who I thought had the best outcomes. So yes, I know there's the cost piece, but I went to who is the surgeon who's gonna give my mom the best outcome. She's 91 pounds, she needs a special little tiny knee, who is she gonna go to? And I looked at that, and then I asked the question sort of backwards. So what implant do you use, who do you work with, you know, how long till she recovers? That's really where the costs end up being, because you'll have implants that are, like you said, $10,000, and then implants that are $30,000 and have a $10,000 screw that keeps it in place. I mean, that's the absurdity around it. I know. We should be in the screw business, right? Go ahead.
How many beds is in the emergency room? Because I know I've got
37.
She said
So-
37 in the very beginning.
Well, how many does Hershey up in?
In their ER,
Yeah.
I want to say 80, 85.
Because they have, you know, you would go there and your bed's in the hallway.
Oh yeah, no. Yeah, I know all about the hallway beds. I try to avoid that. I was an ER nurse, so yeah, it's never good to be receiving care in the hallway.
So do you think 37's enough?
I do, because we also have a fast track and a results waiting area, so those don't count in beds, but they are areas to have people, because let's be honest, if I come in with a tooth ache, you're not gonna, why should I lay in a bed, right? Keep me upright, here's my script, be on your way, you know. Hopefully I never even touch the ER, I'm in the results waiting area, waiting to get what I need. All right, well, thank you so much for having me today. It was lovely meeting you.
Thank you, Dr. Mooney. We have a